5 years ago, disaster struck. On 25th of April 2015, a devastating earthquake shook Nepal. Little did we know then that just a few short years later, in 2020, we would find ourselves dealing with a global, not just national disaster, and that the learnings from our work in the Nepal earthquake would lead our COVID-19 response and planning. On that fateful day in Nepal, within minutes, nearly 9,000 people were killed, more than 22,000 people were injured, and 600,000 homes were destroyed. The Adara Nepal team swung into action. Adara was one of the earliest groups to provide immediate disaster relief. Because of the generosity of our amazing supporters worldwide, in the days, weeks and months that followed, we supported more than 10,000 people in huge need through child protection services, emergency medical assistance, nutrition support and shelter. In the local government area of Gangfedi, every building was damaged or demolished. Gangfedi is known as the epicenter of girl trafficking, and when we first went up there wasn't a girl over the age of 12 in the village. Working in collaboration with local and national government, we created a long-term plan for rebuilding and uplifting education in the region. And we started with the reconstruction of the central Sri Gangfedi school. And then we began supporting 7 surrounding schools to lift education standards across the entire area. Our amazing supporters around the globe helped us touch tens of thousands of lives, and we need their support and your support now more than ever. COVID represents a huge threat to the entire developing world and a potential firestorm in the communities we've been working with for more than 2 decades. The Nepal earthquake sharpened our skills working through a time of crisis, creating plans and strategies to respond to disaster, and then executing those plans to a standard of excellence. We're proud of that. Our 2020 COVID-19 plan is now finalised, and our teams are already working across the world with our work in maternal, newborn and child health and remote community development. From tiny babies, their mothers, and the community that falls into Chiwoka Hospital, Uganda, to the remote communities in Nepal, including at-risk children and the kids in 16 Adara-supported schools. We need your help. We will provide training and support to children and to teachers. We will protect and support health workers and clinicians on the front line. We will provide food and nutrition support. We will offer non-formal and other educational and social support to children and youth whose education has been disrupted at this time. And we will maintain and expand essential health services in the communities we partner with, including neonatal intensive care, maternity and immunisation services, as well as HIV/AIDS support. We will do our best work in the months ahead. Please stand with Adara to deliver life-saving services in this time of crisis. We need you now more than ever before.